And we're back here on Talk with the Doc with Dr. Tim McKnight. Welcome in this morning, as always. It's always good to see you. And I got a question. What is benign prostatic hypertrophic? Because I had to look at it to say that.
Benign prostatic hypertrophy means, benign means not cancerous, prostate, and hypertrophy means enlargement or growth. So that's what that means, and it's common in older men.
So we want to talk about that a bit today.
Yeah, we probably should talk about it because it affects a lot of us as we get older. Mm-hmm. The prostate is a gland that sits right underneath the bladder, and it's the urethra that drains the bladder is surrounded by the prostate, and the prostate actually adds secretions to the sperm so the sperm have some healthy nutrients to survive on its way up to conception. So the prostate gland is about the size of a plum, probably in a young, healthy adult, and as you get older, it gets bigger and bigger in many men. And as it gets bigger, it pinches on that urethra where the urine is coming out, and it makes voiding more difficult. And so a lot of men just have difficulty. They'll have a weaker stream, or they'll dribble, or they'll stop and start, or they have to push really hard as it gets bigger. And there comes a point where often they have to have some type of surgical intervention to open things up. And there's different types of surgeries to do this, and frequently we use medications first. The medications, many of the medications are designed to relax that urethra. There's a muscle in the urethra where the urine is passing through that gets a little bit tight, and just almost like a blood vessel that gets tight with when your blood pressure goes up. So we can relax that muscle and open it up slightly, and that can help men delay the need for surgery, or sometimes not even require surgery to open the urethra up so they can void better.
I suppose we've seen those commercials on TV.
Yeah,
for those. Yeah.
Yes, and it's the problem with it is if it gets too advanced, men will stop drinking water or stop hydrating because they realize every time they drink, they just have a terrible time emptying. And many times there are certain cold medicines that will tighten up that urethral muscle so that you take a pseudoephedrine or some type of cold medicine. There's a warning on the box that if you have benign prostatic hypertrophy or BPH, you shouldn't use this because that tightens it up even more and makes it almost impossible for some men to empty. And so what happens then is you become more susceptible to urinary infection. The urine, as it comes from the kidney and drains into the bladder, is perfectly sterile. But if you can't empty that urine out every time you void, you've always got a couple ounces in. That becomes an opportunity for bacteria to invade and cause infections. And it's actually pretty common as men get older to have these infections. And it's a miserable feeling. They can actually, those infections can go into the blood. They can we call this sepsis when it gets into the blood and can cause someone to die. So we really need to make sure that we're voiding properly and that we're not having too much difficulty with it and when we go.
When is the, susceptibility for cancer, is that related at all to this?
It can be in the fact that often we'll measure a blood chemical. It's actually an enzyme called the PSA, the prostate-specific antigen, and we can measure that, and that often goes up with cancer, but it often goes up with BPH. So you can't just say, oh, your PSA is elevated, you've got prostate cancer. It could be a number of things. When men have intercourse, often that PSA number will be slightly elevated for a couple days, and then it comes back down. Men who are sitting a lot, maybe on a tractor or in a semi, they're driving and they're constantly putting pressure on their buttocks up and down as they're hitting those bumps. That can massage or irritate the prostate and cause the PSA to go up. An infection of the prostate can cause it to go up, and cancer can cause it to go up. So there is kind of a relation when you're looking at the PSA. Several years ago, we would measure the PSA every year starting at the age of 50 in men. And what we're looking for is a steady increase in that number. In other words, we expect the prostate to, over time, slowly get larger, and we can kind of estimate that it's getting larger as that PSA goes up. But if there's an unusual elevation and we can't explain why, then we may have to look a little bit further, either with more more blood tests, or potentially, we send some our patients to a urologist who would do a biopsy if it was warranted. So the PSA is an indicator, but it's not a good indicator. And what was happening is we would get these elevated PSAs, and everybody would think it was cancer. So we'd send our patients to the urologist who would do a biopsy, and those biopsies are not comfortable, and they're 12 sticks of a needle through the rectum into the prostate, because the prostate is right in front of the rectum, and into 12 zones of the prostate. And you could get there's a chance of infection when you do that. So we always give antibiotics for that procedure. But we were often missing the cancer, or we were causing infection. So we've kind of stepped back and said that PSA is probably not the best indicator. And what they are recommending is an annual prostate examination for most men starting at the age of 50, because 25% of prostate cancers have normal PSAs. So the idea is you feel the bump on the prostate as you insert your finger into a man's rectum, and you're rubbing on the back part of the prostate. I struggle with that a little bit because most of us are only feeling about a fifth or a tenth of the prostate, because it's a round object, and we can't reach the top and the front and the sides. But many of the prostate cancers are in the back where our finger could reach. So if we feel a nodule or a bump, then that doesn't mean there's cancer, but that means we need to investigate further. And usually we're allowing the urologist to make that call.
That's an uncomfortable sounding thing, but way better than the needles.
Yeah, it is, and we've learned a lot over the years on how to address this. We've learned a lot to not be overly aggressive with an elevated PSA. Sometimes you'll treat a man with an antibiotic and then repeat the PSA, and it improves. Sometimes you just give it time and it'll go down. So we try not to overreact to that, because we've done that in the past and we've caused problems. But prostate cancer is the leading cancer in men, and so it's in the top 5 list of cancers that with a high mortality rate. So it's not something we want to ignore. But many prostate cancers are very slow growing, and it gets a little complicated because we score the aggressiveness of these cancers based on a number of factors. You can't just look at the PSA. And but the saying is, a lot of men die with prostate cancer because it's slow growing, not from prostate cancer. So those are the ones we don't want to get real aggressive with surgery, because it's likely to not be an issue down the road. But we need to know exactly what we're dealing with. So usually some type of biopsy is required, and then it's close monitoring of the PSA and the prostate growth, and all kinds of algorithms to determine how to do this. So it's not as clean cut as people would like it to be, but it is an important problem.
Are there any everyday things that a man can do to improve prostate health?
Well, I looked at this before we talked about this, and the reference I was looking said, no, there's really no good preventive measure. But I have heard at different conferences I've been to that there's some good evidence that a low animal fat diet, in other words, not eating a lot of animal flesh, particularly the fat, can lower the risk. We've talked before about sugar. Sugar causes insulin to go up. Insulin is a growth factor. Insulin makes things grow. And so that's probably something that we also need to be careful of, that we don't eat too much sugar, because that can potentially, theoretically at least, cause the prostate to grow. I don't know if there's any proof of that. One thing that people need to understand is that we often see, when men have prostate cancer, we often see low testosterone levels. And we used to think testosterone feeds prostate cancer, but it actually doesn't. So I think one of a good preventive measure is maintain high, healthy testosterone levels. And if they're low and you're feeling the effects of low testosterone, I think you should be taking testosterone. One of the things that testosterone will do in the body is it will convert to estrogen, and in men also. And estrogen is good for the blood vessels, but it's also good for the prostate, and it helps to keep the PSA down. In fact, I've used estrogen to help lower a man's PSA in men who have prostate cancer. When they have active cancer, we don't give testosterone. And when there is cancer outside of the prostate, we don't give testosterone, because that can potentially make it grow, and it gets really muddy when we're trying to work with urologists. So we try to be careful there. But I think as a preventive measure, having a healthy testosterone level is probably really good. And obesity is also associated with prostate cancer. So we want to keep our weight down at a healthy weight as well.
Leafy green vegetables.
Leafy green vegetables, yes. We should always eat those. We should eat berries. They're very rich in antioxidants, and that's also good for the prostate.
Dr. McKnight, thank you. Appreciate that.
You're welcome.
That's Dr. Tim McKnight as we talk with the doc this morning.